Is meeting religious leaders in Durban. They are discussing government's measures to contain the spread of COVID-19. Now, Zigalala is convening the meeting in his capacity as chairperson of the KZN command team. The team is guiding the province's response to the pandemic. Now, this meeting comes at a time when the tally of those infected continues to increase. Last night, government's figures put the number of those infected nationally at 274. The meeting is being held behind closed doors. Zigalala is expected to address the media right after that. Now, South African non-government organization or NGO Gift of the Givers says it's working on setting up more testing sites across the country for coronavirus cases. The first testing facility was actually set up in Mayfair, Johannesburg. That's just to the west of the city centre. Other testing sites are to include the Dome in Randburg, close to around the Northgate area, while Roshni out in Vereniging is another area as well. A COVID-19 test will be charged at a discounted and subsidized rate now of 750 Rand. Now, of course, we do live in an invisible world of germs, from viruses, bacteria, parasites, and even fungi. And just because we don't see them doesn't mean they aren't a risk to our health. Now, by touching your face, your nose, your mouth, all the like, we can transfer germs into our bodies. The National Institute of Communicable Diseases says hand hygiene is as an important measure in the current outbreak of COVID-19.
Every single day, we are exposed to germs. Amid the coronavirus outbreak, the most important preventive measure, hand hygiene practice. Some are aware of this, but how well did this resident do?
I think I did well because it's only number 4 that I missed.
Still, it should be thorough. In this bustling Alex Street, lined with hawkers, coming into contact with customers is unavoidable.
It's a bit scary because I handle cash with my bare hands. What must I really do to avoid this virus? Must I always wash my hands?
Some customers feel this might be a solution, but soap and potable water must be used. And to stay healthy, washing hands thoroughly should be a daily practice.
So I'm going to put the same germs.
These medical practitioners know better than most.
This is glow germ gel. It is a glow-in-the-dark artificial germs that you have on your hands every day. Often you can't see the particles with your naked eye.
And then, the wrong way of washing our hands. The germs are still there.
After a quick wash like that, you can see the most problem areas are the wrists, the creases of the palms, in between the fingers, under the fingernails, and in between the fingernails as well, you can see.
This is how it should be done.
After proper hand wash first, you open your tap with your elbow, then you wet your hands with water, then you take your soap, enough soap to cover all your hand surfaces, then you rub your hands, palm, because as you saw previously, the creases of the palm still had some germs. Then you do your in-between fingers. So this is like 5 seconds on each. Then palm with fingers. Then you rub back of fingers to opposing palms with fingers interlocked. Then you do rotational rubbing on your left thumb, rotational rubbing on your right thumb, rotational rubbing of your fingernails on the palm, fingernails on the palm. Get to the wrist properly, then rinse your hands with water. And then you close the tap.
With your elbow.
With your elbow. Dry your hands. And if it's not an elbow tap, you can always close with the tissue. So you can take off the tissue first, then wipe your hands, then close the tap with the tissue that you just wiped your hands with. And we're going to show if there's still any germs on my hands.
Alright. They are very clean.
So as you can see, no more germs on the wrists, no more germs on the creases in the palms, in between the fingers, on the cuticles, there's nothing underneath the fingers, nothing.
And there are many other germs that can be prevented through scrupulous hand washing.
These are germs that cause diarrheal disease, which is a real problem in our country, and especially for children under 5, and many types of respiratory disease, not only coronavirus, but influenza and the causes of the common cold. So hand hygiene is the single most important preventive measure in the current outbreak of coronavirus disease, but also for everyone to protect themselves every day from a range of diseases.
As the old adage goes, prevention is after all better than cure. SABC News, Johannesburg.
Now, the Social Security Agency, that's SASSA,